some of the allegations that there could be inappropriate practices started here. And the individuals who came out to speak, saying that perhaps the services that had been offered or the way in which these services had been procured might not have been appropriate, were here within Uasin Gishu. That's the reason why we are giving a lot of time to this particular county to ensure that we can adequately capture data and adequately capture information from anybody who may be available to speak to us. As I said, the committee is tasked with finding out about transplantation, not just kidney. Kidney comes to the fore because that's where the issues were raised. But actually the transplant that happens the most in most countries is actually the eye. People who get what we say are called corneal transplants. Now, with corneal transplants, the transplants are actually from people who are deceased, who no longer need their eyes to see. We believe the good Lord made people with 2 kidneys for a reason. So if you're going to function on 1 kidney, you need to know what are the risks that you will face if you only have 1 kidney. What are the things you need to take care of? So while you can function on 1 kidney, you need to be very clearly aware of what choice you are making. So that is why it is important for us to talk about not just the eye or bone that also happens in terms of donation, but to talk about the kidneys because it is a live, what we call a live donor. There has been the process of drafting a law that would be able to regulate tissue, transplant, blood. It has not yet become law. It has still been in the process, and I believe that from around 2023, perhaps it has not moved enough to be able to have become legislation that we can then say this is law.
Mediheal participated today in the process, and Mediheal turned up with a view to confirming their preparedness to cooperate with the committee to avail all the material the committee may require to satisfy itself on the propriety of the transplants that were done by Mediheal. And in our appearance before the committee today, we made those assurances. We confirmed having delivered the documents. We confirmed our preparedness to supply any other material that is required. We confirmed our preparedness to answer any questions that may come up, and to answer any issues that come up in the course of their work, and also to make our input also on the scope of the committee's work, being also to set up a form of a legal framework within which tissue and organ transplants can be done.
My being here today is because of the honorable responsibility I have been given as chair of the Independent Investigative Committee on Tissue, Transplant and Organs for the country. And our responsibility is to be able to investigate all the services that are being offered within this country that provide tissue or organ transplantation, and to determine if they are being done appropriately and at what standards and what levels, and if there is adequate regulation and policy that enables these services to be offered appropriately for Kenyan citizens. This week, we are here in Uasin Gishu, and we are going to be here for 4 days, where we are providing an opportunity for anybody who has any interest in this area to be able to provide information to the task force. We are available to listen to those who may want to come to speak to us in public. We are also available for anybody who may want to speak to us in private. We have provided a telephone number, an email address at which you can contact us so that we can make appropriate facilities available for you to come and speak to us. For those who want to come and see us within the public domain, we're actually at the social hall, and we will be here for the next 4 days, very available and very willing to collect any information you may want to give us.